So, good evening, friends, and welcome to another amazing episode of Crossing Boundaries. We are in session 6, and we are super excited because, every month we are sharing one topic with all of you. And what we've realized is many of you have called us and told us that, you've liked our sessions and it's been very informative. In addition to that, you also found that these sessions answered a lot of your questions. So thank you so much for that valuable feedback. And many of you had also called and said it was nice to have a YouTube recording because you could go through those videos again and again to understand certain issues which you didn't understand earlier. And thank you for all those good words you had to say about us. And we at Dr. Vidya's Mind Dental Clinic just take an extra effort so that we can reach out to you as we cross boundaries and come out of our houses through this online medium just to help you understand a little more about dentistry and answer your dental queries. So with no further ado, I want to take you to today's session on crowns and bridges. Okay, friends, so I'm sure you're all able to see my screen, and today we are at Crossing Boundaries session 6, and our topic for discussion today is going to be crowns and bridges. So many a times what we want is a good smile, and that is what the patients would come to us for. They will say, doctor, we want to have a nice smile, or when I smile, I should feel confident and I should feel happy about, sharing my smile. So many a times what prevents us from smiling ourselves is only because we are not able to show off our teeth, and there could be many reasons for that. So imagine a tooth is fractured or broken down, and or it is decayed, and that is the reason that you are unable to smile. So at the end of the day, after the basic treatment, what we do, we try to give you a kind of a cap or a crown, as we generally call it. And there are many types of it, and that is all what we're going to see through this presentation today. So when we say an inlay, we basically mean that a cavity has been a little more bigger, and we are trying to, fill that portion, not only with a filling, which you might have an option of that filling coming out a number of times. So we do a procedure called an inlay. Now, if that cavity has become a little more bigger, then along with that inlay, we do something called onlay. So here, it will be covering on the top of the tooth. So it's on the tooth, and it will be covering a little more of your cusp. So what is a cusp? A cusp is that protrusion over your teeth. So just roll your tongue and touch the top surface of your teeth. You will see a lot of areas which is actually protruded. Now that is that area which we call the cusp, which is going to be covered by that onlay. Now, what is an overlay? When more part of that cusp becomes, treated, or due to wear and tear, we need to probably even fix that portion. And that is why we call that we need an overlay. Now, when we say we need an overlay, it is very important for us to know that it cannot be a single sitting procedure. So whether it's an inlay, an onlay, or an overlay, it is not like you can come to us and we get the treatment done and then you can just leave. You need to get a 2-visit appointment, and that is how you'll be working on it. When I look at the tooth, you will see an inlay. You can see in this picture a pink colored portion. So you will see that it is a very small, cavity like thing inside your tooth. An onlay is a little more spread, and a crown is actually covering the sides also. So when you look at the inlay, the onlay, and the crown, there is more surface of your teeth which is actually involved in a crown. Now, this is very important for us to know for 2 reasons. One is the time which will take for you to get the treatment done. And 2, that whatever might be the situation, we are trying to save your teeth. As all of us know, prevention is better than cure. So we try to prevent as much as the caries spread. But once it happens and we are to involve a major portion of your teeth, again, our job as a dentist would be to preserve or conserve as much as the teeth as possible. So when you look at the inlay, it's a smaller restorative component of your teeth, which is going to be restored. An onlay is a little more bigger and a crown is a little more bigger, right? So there is a particular way where we need to prepare the tooth so that it is comfortable for the tooth to accept this inlay or onlay. And as we prepare the tooth, we also take into consideration the remaining portion of the tooth which is going to receive this inlay or onlay. Now, as we do the preparation, we also look at the ideas of occlusive forces. When I say occlusive forces, I mean when you bite your teeth, you want this filling to be well in place. That is one. Two is you must be able to bite and eat whatever you can, right? So for this, we need to also look into consideration the kind of the filling we are doing, the material we are using, how much of this material is going to withstand that occlusive force. And if you look at our mouth, it just does not bite up and down. It bites side to side too. So we need to also understand that aspect and then use the proper materials to help us complete this restoration. Now, many a times you would have heard about your doctor talking to you about a crown after a root canal treatment. So in a root canal treatment, like we had already shared in the previous crossing boundaries, we spoke about the root canal treatment where the tooth could get affected and you can have the upper portion of the pulp in the pulp chamber or the root canal getting affected, and sometimes the effect can happen also on the bone surrounding it, and all this together might cause a little bit of discomfort for the patient. Hence, we remove that pulp portion of the tooth, clean the tooth properly, and after that we fill it up with an inert material, and then we try to restore the tooth back into its form and function. Now, why do I say form? When I say form, I mean I'm going to restore that tooth in such a way that the shape of the tooth is going to be harmonious with the rest of the teeth. When I say I'm going to restore its function, each of our teeth has a function. A front teeth is going to help you cut your food into smaller particles and help you in biting the food, something like a shear force, right? But the back teeth or the posterior teeth will help you in grinding the food. Now, when I say grinding, I mean I break down the food into smaller particles and make it into a nice bolus so that I'm able to digest and push it down my throat. So this is very, very important. So when I look at the crown and bridges, I can put a crown over a tooth which is actually a treated, or I can use it as a crown for a root canal treatment done teeth. I can also use it over an implant. I can use it where I have a tooth missing. I can take support of the adjacent teeth, or I can also use it like a veneer where I'm only going to do it on the front portion of a tooth. So let's just look into all these aspects. So first I'm talking to you about a veneer. Now I'm sure most of you must have seen people wearing contact lenses, right? So when you ask them to show their contact lenses, it will be like a very thin layer wherein they place it over the eye. Now it is very simple. You can remove it and you can place it. Similarly, the veneer also covers the front portion of your tooth, and this will give the form, the color, the shape, and it also helps the tooth have a very good, smile. So whenever the patient smiles, or you want to have something called, a smile designing or a complete tooth rehabilitation, then we can use this veneer. A veneer is something like a nail polish, or, you can, nowadays you have these nail extensions. So something like that is how your veneer would be. So whenever you think about the nail extensions, people placing it over their nails, and You will also have many people, coloring them and, trying to beautify them. So similarly, over the tooth, you would have this veneer, which is going to be placed, and we can do this in two techniques. You can either do it direct or indirect. We'll have a special session only on veneering. And ultimately, when you look at it, it looks something like that. So we'll prepare your teeth, and each tooth will have a veneering. And this is a smile design procedure. It can take at least, a week or 10 days to complete this entire case if it's for many teeth. If it's just one or two teeth, we can do it faster. And this we can do it direct or indirect. When I say direct, we do it on the chair. It might take about 2-3 hours to complete the procedure. And if it is indirect, we need to send it to the lab, and then they would make it and then send it back. And again, these are material based. So you can either do it in composite resins, or you can have zirconium or ceramics, and we can do it for your teeth. Now let's come back to what is dental crown. So I told you there are many types of dental crowns, and let's just look at the advantages and disadvantages of few of them. So if we can go in for a metal crown. So many a times in yesteryears, you would have seen people opening their mouth, and you'd have seen an all metal crown, or it will be completely black in color. Now, all this all metal crown is very good. It's very strong. But when you open your mouth, they will know that it is a metal there. So the aesthetics is poor. The patients could have some allergies. And many a times when you're traveling or in a flight, during the check, you would have this metal sping up, right? So you might hear some sound. So this is why many a times people don't want to go in for an all metal crown. Next is the all ceramic crown. Now, what is all ceramic crown? It's going to look just like your tooth, and it is very natural. It is very biocompatible, which means you will not have any allergies. But when you compare it with a metal crown, maybe it's a little less stronger than the metal, but it is a little more expensive because it has an aesthetic look. It has a very good look. Nowadays, people are mostly moving towards ceramic crowns. Now, we also have another option of a porcelain fused to metal, which is metal ceramic crowns, wherein metal will be inside, ceramic will be outside. So this is like having best of both worlds, right? So you'll have good aesthetics, less costly than ceramic. And there is a disadvantage because you'll have a gray line. And because of the gray line, with age, when your gums recede or they come down, you would see this gray line. And that is why many people don't want to have this porcelain fused to metal. Next is the Zirconia Crowns. Now, Zirconia Crowns is the best. It is very good looking. It is strong. It is biocompatible. And what is the disadvantage is if you make, the impressions, you need to have perfect impressions to give you the perfect crown. Now, if there is any mismatch, then we can't do any adjustment on the dental chair. So that is why we need to take care when we prepare these crowns. So many a times today, we find patients not going in for the all metal crowns, even if it is at the back teeth. They want to go either for the all ceramic crown or the zirconia crown. Metal with ceramic has also become very less nowadays. So here are the picturesque, look of these crowns. You have these stainless steel crowns, which we generally use for children because, their jaw is growing, their teeth is growing. So we generally use the stainless steel crowns only for kids after we do the root canal. The metal crowns I showed you, it could be all metal, which could be black. Sometimes we also go in for gold crowns. Gold crowns are a little more expensive, but they are the best. Only disadvantage is the gold color, but many people like it because it's a sign of, prosperity. And we have the all ceramic crowns, all resin crown. When you compare the all resin versus all ceramic, All resin is a little less strong when compared to the all ceramic crown. Then I told you about the metal fused to porcelain or ceramic crowns. Many a times we find it is the best of both worlds, and people go in for those crowns also. Next is the bridges. So the word bridge itself helps us understand many types. Like, see, when you see a road or when you see waterways, you will see a bridge which connects the two parts of the land. Also, when you see a road, again, you will see a bridge. The bridge will actually connect two areas of the road. So these bridges are actually trying to connect. So that is how, even in the dental issue or the dental arena, they connect teeth. So imagine you have one or multiple teeth missing. Now, if you have one small teeth missing, now generally say the lateral incisors or the lower teeth, you don't feel like grinding the adjacent tooth completely. So you have something called the Maryland Bridge or a butterfly bridge. You can see the picture one, where you can see it looks like a butterfly, right? So you have the tooth in the middle, and the other two sides, you have a butterfly kind of extension. And this gets attached to the teeth. Very minimal tooth preparation is done. So that's the first preference of choice. If the tooth which is lost is a smaller tooth in comparison with the two adjacent teeth. Next, you have something called a cantilever bridge. Here, as you might have heard about the word cantilever, that means you have support only from one side. So when you have a bigger tooth which is there and adjacent to that only one small tooth missing, you can use this cantilever bridge, and that helps you to again save another tooth from being prepared. Next is a regular bridge where one tooth in the middle is missing and two adjacent teeth next to this open space is prepared. So the tooth which is prepared is called the abutment tooth. The tooth which is missing, that is where the pontic area, so we call it the pontic tooth. So that is how you will have two abutment tooth and one pontic tooth, and that is how, if one tooth is missing, minimal, you will have to take support from three teeth, right? Okay. So this is how we need to understand the different types of dental bridges. So what do we do when we are working on this? We prepare the tooth. So we take a burr and then we prepare the tooth on 5 surfaces. So outside, inside, top, and the 2 adjacent sides. So that is how we will prepare the tooth. And as we prepare the tooth, you can see that once we prepare, we take a lot of care so that your tooth as such is a lot more healthier and it is in a position to receive the crown. Now, this is very important, especially when you look at when we do multiple teeth procedures. So in multiple teeth procedures, we are very careful that, the adjacent teeth are not cut and the gums are healthy, the bone is healthy, which is going to hold the tooth, and all this together plays a very important role. Next is when we place an implant. So when we place an implant, implant is inserted in an area where there is no teeth or tooth. So imagine we are extracting a tooth and we are placing an implant there. I will take a complete new session on implant. And once we place the implant, we wait for the healing process. In the upper jaw, you need to wait for minimum 6 to 9 months. Lower jaw, we need to wait for 3 to 6 months. And that is the waiting time is called osseointegration. Osseo means bone, integration means union. So the implant actually reunites with the bone. And then you have the dental abutment. So that is being placed on the implant. And this we do it after this osseointegration phase. And after that, we place a crown on this implant. So this crown, again, we can place it. We can have different types of crown. And this crown can be a single unit crown or a multi-unit crown. And this will help you again be placed on the tooth, and it will help you bite and eat properly. So here you can see a picture of the implant with a single tooth replacement with a single crown. Sometimes we also do multiple teeth. So whenever multiple teeth are missing, we do a bridge. We try to, take into consideration what all teeth can be saved. And then we give a scaffold with a metal. So this will give a lot more strength to the ceramic. And then over this, we place the ceramic and we have this. So sometimes when we do like this full mouth rehabilitation case, we also try to see that the patients are able to bite and eat comfortably after this entire procedure. And that is very important, especially in the elderly patients where, eating, when they don't eat properly, rather, they have other issues as health issues, their bowel movements become a problem, and all this we need to address, right? After we prepare the tooth, we do something called a shade selection. Now, when I say shade selection, you should understand a tooth is not white in color. You have the dentine and the enamel. So the dentine is yellow to yellowish brown, and the enamel is white to yellowish white. So when you take a mix of both this enamel and the dentine, we need to exactly find out what color of your tooth it is, and we try to see it in different light zones. You must be very aware that we have something called the light of the dental chair, which is a lot more yellow in color. And then we see the natural light, so that when you go out in the natural light, nobody should be able to make out that you're wearing a crown. And we also see under tube light, so that, it gives you a good match. Now, as we see and as our eyes are trained to see these colors, we also take opinions from the patients so that they also are a part of this selection. Now, along with the patient, sometimes even we involve the laboratory personnel, and these dental technicians also are a part of our 3-unit, procedure. That is the doctor, the patient, and the laboratory. So when you have this kind of a good communication of the shades, it is easier for the laboratory personnel to actually recreate nature along with its beauty. Now, why do I say beauty? Each tooth is, very unique. You have a lot of characteristics on the tooth, and we work this on SPA factor, which is sex, personality, and age of the patient. So that by each tooth is a craft or a beautiful piece of art by itself. So once you do that, we are able to, get that to our dental practice. And then we use a cementing medium. You place it on that crown or the bridge. And then we place it on the tooth, and we ask the patient to bite. And any excess cement, we try to take it out. And then we use a small probe to remove the excess cement so that you don't have any irritation on your gums. And after that, we apply Vaseline so that the patient saliva, which is there in the oral cavity, does not contaminate this setting time of the luting cement. And then the patient is good to go. And general instructions which we tell for these patients are, after putting these crowns and bridges, we tell them like don't drink water or have any food for the first 2 hours. We generally keep a piece of cotton and ask them to bite as they go out. And this is again very important, just to act as a reminder that they don't wet their mouth. Even the saliva which is in the oral cavity, we ask them to suck it in. And as we told you, a crown can be of various materials. So if there is a chip of the ceramic, you can bring the crown back to the doctor and get only that chip repaired. It can be done either in-house in the clinic, or they might remove the crown and give it to the lab, depending on the material used. And many a times we have heard or seen patients come back with a crown completely removed. So we generally tell the patients to not eat any sticky food substances when you are wearing crowns, especially multiple crowns, because it can create a negative pressure and pull out this crown which is being cemented. So if the crown comes out, then you just have to clean up the crown. And if the crown is in a good shape, then you just have to clean it and re-cement it. Sometimes the crown can get fractured or broken or worn out with time. So in such cases, we replace the crowns maybe after 5 years or 10 years, depending on the patient's usage. And along with that, we help the patients get a new crown. Now, many a times I've heard patients ask me, why should I replace a crown? So I'm sure all of you must be driving some kind of a vehicle, either a two-wheeler or a four-wheeler, and you must have seen a new tire. Now, a new tire has a lot of, indentations on the tire. But imagine you're trying to use this vehicle of yours on rough roads. So the wear and tear of the tire is going to be faster than a person who's going to use it on smooth roads. So many a times I've seen that non-vegetarians, try to, lose out on their ceramics faster than a vegetarian. Other than that, the usual instructions are there. This tooth becomes a part of your oral cavity. You can bite on it. You can, brush the teeth twice daily. You don't need a specific brush or a paste to use over this. But see that the paste is not very abrasive. And if you're taking any staining food substances like, say, tea, coffee, or any other habits like smoking or alcohol, you might get this crowns which could get stained. But again, with a dental visit, they will be able to remove these stains and give you a nice looking crown every 6 months, especially when you come for your cleaning procedure. So with that, we come to the end of today's session. I'm just going to show you some pictures of patients where to help you understand. So here you can see in the first picture, the tooth is fractured. And in the second picture, you can see that, sometimes we generally do a filling material, and still the patients after a few times, they would say it's the filling is getting broken. So in those cases, you can definitely give a crown in this cases. Sometimes you will have gaps between the teeth. So to have a very even smile, you can do a multiple crown and bridge procedure so that the patient has a beautiful smile. Sometimes, as I told you, we do a complete oral rehabilitation where the patient could have a short teeth, or they might have lost the teeth because of grinding, and the gums can be weak. So we do a complete oral rehabilitation and give them beautiful crowns so that they can smile better. And here is a before and after picture. And many a times, especially when the patient becomes around 60 plus, due to the wear and tear and, being very, having a procedure or a process called bruxism, where they keep grinding their teeth, your muscles of mastication are working very hard. And in those cases, you will see the teeth is totally, gone, or we call it mutilated teeth. Now, in such cases, it is very important that we restore the smile, and that is how you look at the smile for the patient. So I'm sure you will all have a little bit of doubt. So let's answer your questions. And thank you for your patient listening. So you can ask your questions, Raghu.
Yes, since I undergone that implantation, no? Correct. About nearly 15 years back.
Correct.
So you, afterwards 2 years back, I came to you, then you are given the treatment for that, strengthening that one. I really benefited with that. And you very say what I would say, the technical, very small portions taken care very nicely and without any pain. Say that was the uniqueness in Smile Dental Clinic. That I would say really hats off to the clinic support.
Thank you so much. Thank you so much for your feedback. It really means a lot to all of us because we try to do our best, and I guess during the pandemic, this has been a very challenging time when many of our patients wanted us to answer their queries on various topics, and so that is how we started crossing boundaries. And now I guess sitting at the comfort of your house, you're able to hear the session and learn and revisit. In case you missed it, you can go into the YouTube channel and again understand and learn and ask your questions again. And thank you so much for supporting us, and also for your comments on the videos. Thank you so much.
What you suggested, the maintenance of our teeth is regularly, and it is reminding us through your regular reminders. That is, the session is there. So based on that, at least we maintain our teeth. So remembering Dr. Vidyaa Smile Dental Clinic, we take our own glister and maintaining the floss, that one. It is a reminder for self-reminder. Thank you for keep on tending that one. And this is interacting with a senior international doctor, meeting through Zoom session. It is really a blessing, and you are supporting and doing the great service to the society.
Thank you so much. Thank you so much for coming, being a part of the session, and for all those good words you had to say. Thank you for being our valuable patron. We cherish this, collaboration. Thank you. So I think we come to the end of the session. So you'll be seeing this session on YouTube, and I'm sure it will give you a lot more insight. And whatever you want to learn and whatever you have questions on this, if you have not been able to attend also, you will be getting all those questions answered, and it's going to give you a lot more insight into many aspects of this aspect of crown and bridges in dentistry. So thank you so much for coming today, and have a great day. Take care.